Alright fam, watch to the end and get a tasty diagnostic treat on cracked tooth syndrome. Okay, so this is an evidence-based short, and today we're talking about cracked teeth, my people. Doctors Lynch and McConnell in 2002, rep in Calgary. Quick facts. Incidence of people 30 to 50, but can be seen in anyone. Mandibular second molars, followed by mandibular first molars, and maxillary premolars are most commonly infected teeth. They tend to extend in a mesial-distal direction, but can be buccolingual if tooth is heavily restored. Diagnosing questions to ask. Do you have pain on biting? Is it ever on release? Do you have pain on cold, hot, or sweet? Has this ever kept you up at night? Did this occur when you were eating something hard? Have you had a cracked tooth before? Do you clench or grind your teeth that you're aware of? Upon clinical exam, do they have wear facets and evidence of parafunction or large intracoronal restorations like composites, inlays, or amalgams? Can you tell me which tooth it is? Oftentimes, patients will have a hard time describing which tooth is the culprit. It's because there's no proprioceptive fibers in the pulp. Vitality testing with cold tends to be positive and non-lingering if the crack is peripheral and not causing thermal pain. Most significantly, pain can occur from pressure applied to an individual cusp in an oblique way. You can test that with a tooth sleuth. In diagnosing cracked tooth syndrome, you must exclude pulpal, periapical, and periodontal pain, as well as medical issues like psychiatric and orofacial pain. Quick and dirty way to determine if the tooth is cracked: place an orthoband on the tooth and do an occlusal adjustment. It should immediately alleviate their symptoms. I'll include a clinical flowchart in the description to help you with diagnosing cracked tooth syndrome to make your decision-making process more systematic in nature. Subscribe and like the video. Yeet!